Okay, we ready to begin, Jason?
Yes. Yes.
Welcome, everybody. My name is Rich John. I'm on the Tompkins County Legislature, and I'm guest hosting this week's town hall. And I wanted to start out just by saying something really inspiring. However, I couldn't really think of anything. This has been a very, very long, hard time. Um, but I think there's some thank yous in order. Certainly, I know how hard everybody that you can see on the screens has worked on responding to this crisis. And this has been a long haul. They've worked, nights and weekends since February and March to lead us through this. And frankly, Tompkins County's done pretty well. We certainly have COVID cases, but we should be very proud of the response we've had. And for everybody in the community, all of you that are watching that have taken it to heart and been careful, wear your mask, practice social distance, wash your hands, think about what you're doing to slow the spread. It's really worked here. And I worry that our success can make us complacent, that it seems like it's not as much of a problem. Unfortunately, if you turn on the national television, you can see it's a real problem in some other places where they haven't been as prepared as we've been here. So I hope that everybody's in this for the long haul. We have a lot of things to do to get to the finish line here and just continue the social distancing as we do our reopening. And you're going to hear more about that issue in tonight's call. We are moving forward. We're close. I hope we're really close to the next phase, but you'll hear more on that one. The one thing I wanted to talk about was graduation. So many people have family members that are either graduating from middle school, grade school, high school, college. One of my daughters just got her graduate degree. She's going to be a teacher, and she had to finish her graduate program virtually online, doing student teaching, and she struggled through that. And I'm sure that there are stories just like that in households across the county. We need to celebrate those people that work so hard and are deserving. And certainly our high school graduates are coming up very soon. But if you know somebody that just graduated college or is about to graduate high school, I hope you think about reaching out to them. We can be creative, we can do it in a safe way, but we need to make sure we celebrate all these people. With that said, I'd like to introduce Jason Molina, our county administrator. Thank you, Jason.
Thank you, Rich. Appreciate the introduction, and congratulations to your daughter as well for graduating grad school. Quite an honor. And I'll second congratulations to all our upcoming graduates, whether it's high school, college, and so on. Great accomplishments. And I agree, with some creativity, the honor and the appreciation isn't lost. It's just appreciated in a different way. Just a quick introduction of who we have with us. We have Amy Hendricks, our Deputy County Administrator, who's been heading up the Emergency Operations Center, Frank Krupa, our Public Health Director, as well as our Mental Health Commissioner, and everyone's favorite department head, Jay Franklin, the Director of Assessment, who has been reassigned to the EOC and has helped with our planning duties. I always mention that because he has not forgotten his assessment duties, much to our dismay. As a little bit of an update. So Southern Tier right now is preparing for phase 2. And in our past discussions, phase 2 is expected to come 14 days after phase 1, or expected but thought of, assuming none of our health metrics had changed drastically. Unfortunately, that day is expected to be tomorrow. The governor's office, we just spoke with representatives from the governor's office about 15 minutes ago. And as of right now, they are saying we are not authorized to reopen for phase 2. Now, we recognize that other counties in our region have announced that they are reopening phase 2 in anticipation of more information of the state. That is a decision that they have made unilaterally. But in our communications with the state, and the state is communicating with them as we speak, that there are additional things that have to be done in the future, such as the guidelines have not yet been released for phase 2. This is could be changing momentarily. We have another call this evening at 7:30 with the regional control room to see if there may be more direction or changes that may come out, announcements that may come out later this evening or tomorrow morning. But as of right now, we've been advised not to move forward with phase 2 opening until that guidance is provided either from the state directly, or the additional industry guidance is provided on the New York Forward website. I think it's important to understand that not moving forward at this time is not it's not because we haven't been able to maintain our health metrics. It's not because we haven't done anything or we haven't achieved anything. The information that's been passed down to us is that the state is working with experts to assess phase 1 to see what the results were prior to giving the go-ahead for phase 2. Now, like I said, that could change as early as this evening, but when we know more information, we will push it out as quickly and as promptly as we can to our community and to our community partners, the local media that have been great partners in this process over the past 10 to 12 weeks, our economic development partners, Chamber of Commerce, TCAD, which is Tompkins County Area Development, the DIA downtown, as well as our city economic development partners. As we know more information, we will push it out, and we're eagerly anticipating the new guidance from New York State, although we haven't received the details yet. I should say that we recognize that this adds a lot of stress and when we have more questions than we do answers, but we are encouraging business owners to continue to look at the existing guidance for phase 1 industries and sectors. Understand that a lot of the common areas of preparation for a reopening plan, such as density for employees, patrons, testing or healthcare screening, mask wearing or face coverings, are all very similar across industries. There are some nuances, but there's a lot of similarities, and we're encouraging a lot of our businesses, particularly the industries that have been outlined in phase 2, such as professional services, retail, administrative support, real estate and rental leasing, to look at those guidelines for phase 1. Understand that most likely a lot of the guidelines for phase 2 industries will be very similar as they will be for phase 3 and phase 4. There will be nuances, though, specific for your industry, but you can begin, and most likely not begin, but continue the preparation process that you've already started, because most businesses have already prepared this or begun to prepare what their new plan or the reopening plan would look like. I want to also add that we have received confirmation that phase 2, when it comes time to open, would include all office-based jobs, as well as hair salons and barber shops. So now Jay and I can get our haircut done, which was most important for us. Again, specific guidance is not out yet, and when it is out, we will continue to push that information out as quickly as we can. I will say that also, on a side note, the governor did issue a new executive order today that will allow businesses to deny entry or deny service to individuals not wearing masks. So this is something that complements some information we received earlier in the week, in that businesses were going to be required to enforce mask wearing or facial coverings, as well as good physical distancing, not only for employees, but also for patrons. This executive order also now allows businesses to deny entry of those individuals that fail to comply with this, or fail to provide them with service if they fail to comply. All executive orders of the governor issues are online on the New York Governor's webpage under executive orders if you want some more information on that. And again, I think we've discussed this with our economic development partners. As businesses, and this, whether it's retail or other businesses that are beginning to prepare their reopening plans, we encourage them to work with partners, economic development partners, about how you have those respectful conversations, patrons as well as employees, so that we can avoid conflict and continue to protect ourselves and each other as we go through that process. Obviously, nationally, there's been some pushback about mask wearing. We obviously want to protect each other. I wear my mask to protect you. You wear your mask to protect me. And just put some thought and process as to how you'll have those conversations in a respectful manner, so that everybody can protect each other as we go through this. Speaking of such, I do want to just reiterate what we've talked about in the past with respect to mental health resources, including counseling, crisis lines, and other resources that continue to be available to you and for those that are in need. these are confusing and increasing stressful times. And we want you to know that these services are available to you. I wanted to include this and have maybe Frank Krupa, who also, while is doing a wonderful job as a public health director, is also our mental health commissioner. And I thought it may be a good opportunity for him to just share a little bit more about the mental health services we have available in our community for those that maybe for the first time experiencing some stresses or challenges that they may have never experienced before. Frank?
Thanks, Jason. Yeah, we talked a bit about this last week, and I mentioned that our crisis line, suicide prevention crisis line, has seen a significant increase in the calls that they're receiving. And it's really important for our community to know that there are resources that you can reach out to before things get to the crisis level. And so for some folks that may never have interacted with a counselor, a social worker, a psychiatrist in the past, I want them to know that those resources are available. The Tompkins County Mental Health Department is taking new clients. You can call the department and we'll set up an intake. Things are a little bit different. We're doing some work over the phone and through telemedicine, but our clinicians are there ready and willing and wanting to help. Family and Children's Services here in Ithaca is another clinic. They're accepting clients and are fully operational. So if you just need someone to talk to, want to understand what services might be available at either location, please reach out and we'll put that information up in the comments, and it's also on the health department website under resources. And it is important for folks to know that those resources are out there and reach out. These are challenging times, and just like we talked about before, it may be the first time for a lot of people, a lot of families needing supports for help with food or unemployment. These are all new things that we're not used to having to access, and mental health services probably falls into that same category. And it's really important that this isn't the time to be shy, right? Everyone is in need, and if you feel like talking with someone would be helpful, please reach out. We have great counselors that are waiting and available to help you navigate these very difficult times.
Thank you, Frank. Appreciate that. I guess, Rich, we'll turn it back to you to start with some questions that I think we've received over the past week.
Sure. And Jason, if I could just add one in, just at the risk of being redundant, could you just talk a little bit more about our public health metrics, and that to confirm we're going in the right direction? I'd love to hear.
Yeah, absolutely. I mean, so there are several metrics. It has to do with hospitalizations, average hospitalizations over a period of time. It has to do with ICU admissions over a period of time. It also has to do with the amount of testing capacity, contact tracers. Those are 4. Frank, do you have the other 3 off the top of your head by chance?
One is deaths, hospital capacity, ICU capacity, new hospitalizations.
Right. So these are done regionally. These metrics are measured regionally. Early on, some of the metrics were to maintain or to ramp up a capacity. So for example, testing capacity in the region. Obviously, our county has been fortunate by Cayuga Health Systems to be able to ramp up the mobile testing site or the drive-through testing site in early March. That has contributed to the region's ability to provide testing capacity for a time of need if it would need to be ramped up. Contact tracers, our public health department has done a phenomenal job, a much more thorough job than I would say probably almost any county in the state, to be able to quickly respond to positive cases and identify where the source of that positive case may have come from. Again, we've contributed to the region's ability to stand up and maintain contact tracing. So fortunately, our hospitalizations have been well maintained in terms of manageable numbers. It didn't necessarily put a huge stress on the hospital system. ICU admissions, again, were fairly low and be able to maintain. It didn't put a huge stress on our hospital system. So we contribute to a regional approach. But I would say that Tompkins County has definitely been a leader. We've definitely been able to manage the disease. And I think the results from our county alone compared to the region and the state is primarily because of the great public health department that we have, the staff that have worked there, and the collaborative effort we've had with Cayuga Health Systems. That combined, I think, has really put us in a good place, both from a county perspective as well as contributing to the region's stability and reopening ability. So I think we're doing very well. and we continue to do well, and we'll continue to do so.
Thank you, Jason.
Yep.
Amy, we have a question here. Could you provide an update on what's going on at the Emergency Operations Center?
So Rich, you know, normally I don't answer the questions, I only ask them. So this week they set you up to ask me the first question, I see. So I can provide that update, and then we'll switch jobs later on, and I'll remember that, you know, you kicked it off.
Okay.
So the Emergency Operations Center, we are up here with Jay and Frank and Jess Verfus, who's our logistics chief. We are here day in and day out, kind of surveilling what's going on in our response and coming up with what we need to do to respond to that. As I've said before, the EOC, what happens here changes moment to moment. You're really seeing this in live time today. We were actually in the middle of preparing for this event, and we get the call from the governor's office saying, oh, there's a little shift in what we thought was going to happen, you know, just 15 minutes before. So a lot of that time happens, we pull together and figure out what the next steps are and what is the priority for our community. We keep public health in the forefront of the priority because we're responding to a public health disaster. And so that really needs to be the focus of what we're doing. At this time, we're starting to look at how we support the economy and support others and transition out of where we've been, at the same time ensuring we're not going back to that place. And so as far as the EOC, it continues to be a center where we bring people together. We're hearing from our community partners. We have weekly calls with a variety of those partners to ensure that we know what the community needs are and that we have the adequate resources to meet those needs. And it's involved everything from creating our own mask making operation to creating our ROOP plans, to assisting the community in developing those plans, to helping with our colleges think about how they'll come back on campus and when they'll come back on campus. It really runs a gamut, and it really provides an opportunity for us to think outside of our traditional roles, and that's how we get Jay up here working in the planning realm, of what we need to do to make sure that we are assisting the community in the best way possible. So that's a little glimpse of the EOC. And as I said, it changes moment to moment and continues to do so, and it still continues to shift. Another question that continues to come up is, when are we going back? You know, when is this over? And we're still not there yet. We're still trying to figure out what the next steps are and how we're going to move forward to ensure that the community response is still there and how we're moving forward. So that's my answer.
Thank you, Amy.
Yeah.
A question for Frank. Where are our new cases coming from? And do we have a sense of how people are being exposed?
Yes, Rich, we do. And most of our new cases are coming from close contact of other known cases. So they're family members or housemates of known cases here in the community. So that kind of rides right along with what we understand about the disease. Those individuals that have longer, more close contact to someone that is infectious are more likely to be exposed. It also shows the importance of quickly identifying and isolating those individuals, so there's less opportunity for others outside of their household to potentially be exposed. That doesn't mean we have no community acquired COVID-19. We do. A couple of the cases we have not been able to draw a straight line back to where they were exposed. So as you said in the beginning, we need to remain vigilant. We need to keep not get complacent and understand that, you know, we want to move smartly and we want to move in a manner that's going to help us keep the disease from spreading in our community.
Okay. And a second one for you, Frank. If people are hearing that there's a positive case in some public place, what is the health department's procedure for when you put out a public press release or not?
Yeah, that's a question we've heard a lot this week. We've talked about contact investigations, I think, on each of the town halls. And really what happens when we find out about a case is our nurses, as Jason described, they do an investigation. They talk to that individual. They find out where they've been during the time that they were potentially contagious to others. And we identify every contact that they may have had. In some instances, we're not able to identify everyone, and because of an exposure in a shopping store or a grocery store, gas station, and we have to put out a message to the community. But there are other instances where we are able to identify all the contacts to that case, and in those instances, we don't put out a public message. And I would share that part of the reason that we're likely to see more of that, where we don't have to put out public messages, is because of the steps our local retailers are taking. They are enforcing mask wearing. They have put up barriers. They are maintaining social distancing, and all of those things limit exposure. So the more that we can do that, and we can do it successfully, when we do have a case, it means fewer and fewer people will be considered a close contact, and that's how we limit the spread. So it's a great example of all of the work that's being done by our community to implement these new procedures really makes a difference in the potential exposures to a known case.
Okay. And another question for you, Frank, was what does reopening mean for different people? Is it for everybody? Is it back to normal, or are there some populations you need to think about differently?
Yeah, another great question, Rich. I know we're talking about reopening a lot these days, and it's really important, and everyone wants to get back to work, get back to school, and all the things they're used to doing. But for those individuals that are still in the vulnerable population, so our older residents, those that might have underlying health conditions, whether it's, deciding, should I really go to that store that's now open, you have to evaluate your own risk. Right? And there is certainly more risk to those vulnerable populations if they contract COVID-19. So we want them to be careful. And just because something is open doesn't necessarily mean that they should be in a rush to go back. And that goes both for a role as a client or a patron to a store, and also maybe the store owner or operator might fall into one of those vulnerable categories, and maybe it makes sense for them to wait a little bit longer before they actually are allowed to open, before they actually open, and also consider other precautions that they might be able to take. So we just want people to be thoughtful, think about their own situation, their own risk, and make decisions about what reopening should look like for them.
It certainly seems that there've been a lot of people stepping up and helping,
Absolutely.
Certainly for people who are in those vulnerable populations. And if you know somebody, offer to help.
Yep.
Seems to be good advice. Jay, I understand you're the star of the community town halls. A question for you here. Can you give us an update on county operations? How will the public be able to interact with departments, and what guidance are staff following?
Thanks, Rich. What we did as we decided to start to reopen, all of our county departments created our route plan, our reconstitution of operations plan. So we're just right now in the end phase of approving those, making sure that they're addressing all of the areas to make sure that our employees and our clients and customers are safe. So there's a couple of key points that we're looking at, and all of those points address those 4 pillars. Trying to reduce density, the amount of staff and clients that are in our office. So starting on June 1st, we're going to start opening more offices up to the public, but not all of the front doors will go to be unlocked. We may keep them locked in order to try to keep down that foot traffic. We're going to look to keep that distance between all of our employees, between themselves and with the public, by trying to maintain that 6-foot separations. All of our employees are going to be wearing face coverings when they can't maintain that social distancing. And we're going to require that too of all of our visitors. As Jason said, my mask protects you, your mask protects me. We're also going to look at personal hygiene. and make sure that our staff is aware and of the need to go out, wash your hands on an hourly, wash down surfaces in between contacts when the public comes in. But we've looked at how we can address that anxiety of our staff coming back to the office. We realize a lot of them, this may be their first time out, going out into the wild. So we need to make sure that they're aware of these new protocols that we have. We're looking at how our office is designed and set up to make sure we don't get that influx of people. We're looking at how we operate out in the field. We're not just behind the desks, but all of our 27 different departments have done a great job looking at this, putting the public health at their forefront, making sure that everyone is going to be safe when we do start to open on Monday, and as we continue to open over the next few weeks, next to the new months as we go into our new normal.
Okay. And Jason, how can the public be assured that small businesses are taking the right steps?
That's a good question. And I would say, Rich, it's not just small businesses, it's all businesses and organizations. It should probably be included everyone, including ourselves. One thing we are going to do to assist the public as well as organizations is we actually tonight are going to release a checkoff kind of placard that people that have attested to completing a reopening plan consistent with the state's guidelines can post in their place of business to show the public that this is a county placard and that they have completed the reopening plan. So some people can see, hey, I know this business's organization has completed and has complied with the state guidelines. We're not reviewing everybody's reopening plan, but if they have attested to it, they've gone through that process. It has the 4 pillars that Frank and Jay just mentioned on it in terms of the symbols. So it's common icons. And that'll be one thing that people can look out for that will ask business organizations to prominently post at their entryway. So people know when they go in there, they can say, oh, I know this place has complied with what the state's asking us to. The other thing that people can do is simply observe, if employees are practicing good distancing, if they're wearing the masks, if generally most of the businesses I've been into have sanitizer out. It's easily you can see it around. They can observe, and if they see that these things aren't happening, they can make the decision to leave if they so choose. So there's those things that I think anybody can do. Just being observant when you go into a business or an organization and see what's happening around with the employees as well as the patrons in that establishment.
Okay, and a second follow-up there. What is there something more people should do if they go to a store and see employees and customers without masks, or if the masks aren't being worn properly or not covering their noses?
Yeah, they can report it to our public health department and the environmental health unit. There's also the non-emergent dispatch line that it can be reported to as well. We have that information. We can put that information up later. They can, and this is where the respectful dialogue piece comes into play, and how comfortable people feel having that conversation, whether it's with an individual or whether it's with a store manager. You also have to keep in mind that some people can't wear masks for a variety of reasons that we may not think of. There may be health reasons on why individuals can't wear masks. There may be physical reasons why individuals can't wear masks. So when we talk about respectful dialogue, I would encourage an employee, anyone, whether it's an employee, a supervisor, or a patron, or a member of the public, to ask yourself that question before you would take action on it. Another thing we've seen, we've talked just about closed areas such as businesses or stores or restaurants or business or organizations, but when you're out in public, we had some instances this weekend where you had individuals that have been living together, 10, 12 people living together in the same house, their housemates for the past 8 to 10 weeks. And they're outside enjoying the good weather, enjoying the festivities of Memorial Day. Nothing wrong with that. But maybe as a passerby, you might have thought, hey, wait a minute, these people are gathering and they're not supposed to be gathering. They're not wearing masks and they're not social distancing. Well, they may not have to if they've been housemates for the past 10 weeks with each other. I have a family of 6. When we go outside, it looks like a party's happening, with all my kids. But we've been living together for the past 10 weeks. So I think people just have to keep in mind, be conscious of those things, be observant, and don't make any assumptions without thinking through what your next steps may be and why.
Okay. Amy, I think you have some questions.
Sure. Thank you, Rich. So I will start this one off with you, Frank, on guidance on the safety of going to public outdoor spaces. So if a person's going to a park or a recreation area, what kinds of guidance can you give them on being safe in those areas?
Sure, it's the same simple message: social distancing, staying 6 feet away from other individuals, wearing a cloth face covering when you can't. Obviously, we don't want large gatherings of people. The governor spoke on Friday about 10 or less, and we really would want people to take that into consideration. And it's not about trying to make it difficult or telling people they can't do what they want to do. It really is, the science tells us that if we can keep some space between us and we wear those face coverings when we can, it'll help us stop the spread of disease. And I think I'd also add, to follow up on what Jason was saying, the same thing applies. If you're in a park and you see what you think may be people that aren't, following those social distancing or face covering guidance or recommendations, that don't just assume that they're doing it, to flaunt or to just, not comply. You could see a group of 5 or 6 people that aren't wearing masks that are close together. They may all live together and have been together through all of this. And so it is okay for them because they're exposing each other at home. So it is okay for that. And quite frankly, it's more risky for you to go up and talk to them and get within that 6 feet circle to find out why, particularly in a park or a place where there's plenty of open space and you personally don't have to get within 6 feet of anyone. So that personal responsibility, taking action and control for ourselves and doing the right things, exempling the right things, I think we as a community will get through this.
Okay. Frank, on that, and you kind of mentioned a piece of this, when a member of the public is entering a store, how should they prepare to go into that store?
Well, we want them to be aware of their surroundings, right? Obviously, whenever possible, to stay 6 feet away from others and have their mask, right? They should have their cloth face covering on, because they don't know how others are reacting in the building, or how many people might be in there. Will they be able to keep 6 feet apart at all times? So it's best to just keep your mask on when you're going into a business. And quite frankly, it's just a good thing to do to protect other people. I would hope for most people it's just a minor inconvenience that could potentially help keep other people from getting sick. And we don't want to have confrontations. We don't want to have arguments or discussions about wearing a mask. Let's just wear our masks. And when we go out, we're not in a store that long. It's a minor inconvenience to help stop the spread of COVID-19.
So I'm not leaving you off the mask topic yet, Frank. I have another question about masks. In some cases, we know people can't wear a mask. Mm-hmm. And so if someone is unable to wear a mask and they're working, in retail or in other areas where the community perceives that they should have a mask on, how do they handle that? Do they need a doctor's note? How do they handle that with their supervisor if they're unable to wear a mask?
That's really something that they need to work out with their employer. It's a personal health issue, just like any other personal health issue. I would hope employers would take that into consideration. And if there are alternative work arrangements where it might not, create the perception for the public that, somebody's not wearing a mask, let's try to take those simple steps to, avoid, what could potentially create a perception of issue. But it's just like any other health-related thing. we still have a right to privacy. And, working through that is going to be challenging with masks, just like it is with any other health issue. And, just because you may not even be able to see, right? That's also important to understand, that you can't always see the health issue that somebody might have that could cause them not to be able to wear a mask. And quite frankly, in most cases, you wouldn't be able to see. So we don't want to assume, and I would hope that the employee and the employer would work to, address that issue in what is an appropriate employer-employee relationship manner, and that they would consider perception of the public and how they might make adjustments in order to avoid those kind of things.
Thanks, Frank. I'm going to actually pass this over to Jay to talk a little bit about what we've decided to do with masks and providing accommodations for our employees in case they cannot wear a mask. So Jay, if you could talk a little bit about our directives to our employees in mask wearing.
Yeah, our directive at the county is to wear that mask when you're unable to keep that 6 foot of social distance. So typically, if you're at your desk or your workstation, you'll be able to take that off and take a sip of soda if you want. That's one thing I missed while walking around my office, was taking a sip of coffee as I walked around. It was kind of hard to sip through a mask.
No sugar sweetened beverages, Jay. No sugar sweetened beverages.
It's seltzer.
So, but we also do realize that, there are people who can't wear that. And just as the same as we do for other instances where an employee is unable to perform a function of their job for a reason, we'll have that employee fill out a reasonable accommodation request form that'll then be reviewed by our HR department to try to look at how we can accommodate that individual moving forward. And it may be having them not be a public facing person to where they can stay in their office, maintain that separation. So by them not wearing their masks, they're still able to protect the others that are surrounding them.
Great. Thanks, Jay. On, how we're doing our operations, and a little into that is, are employees required to be screened as part of this? And Jason, I'll turn this to you. As part of the reopening, are they required to be screened? And how do the businesses handle that?
So screening is really asking 3 separate questions. One, do you have symptoms that would be similar to COVID-19? Symptoms include fever, cough, sneezing, body aches, those types of things. Another question is have you been in contact with someone who's tested positive for COVID-19 in the past 14 days? And the third question is have you been under directive by the public health department because you may have been exposed by someone who's a COVID-19 case? And that has to do with a similar instance of where we have a public disclosure of a facility or a business that may have had an exposure to a large amount of people. So if any of those questions, those are generally the 3 questions that would be asked of individuals. And if an individual answers yes to any one of those questions, then the direction we're giving our employees is that they should then speak to their supervisor immediately, go home, seek out the advice from their healthcare professional as to what are the next steps. And that may include getting tested. It may include being quarantined for a period of time, and depending on the results of the test, it may also be if they're quarantined because they're asymptomatic, or if they are symptomatic, depending on the results of the test, if they get one, it may determine whether or not they have to be in isolation or remain in quarantine further. That's all specific. That's all specific based on the incident of the individual. So those are the 3 healthcare screening questions that you generally want to ask your employees every day at the beginning of their shift. And as far as the county is concerned, we'll be giving guidance to our folks shortly in the next few days about happening on a daily basis and attesting to those 3 questions on a daily basis.
All right, thank you. So we hear a lot of information about how businesses should interact, but there's also the personal life and people going to barbecues or being invited to other places. We now have this new change where, gatherings under 10 are allowed. How can we gather safely? And what advice do you have for that? And I'll look to you, Frank, for some information there.
Sure. Just like everything else, if you're going to visit other people, keeping distance wearing a mask when you can. I know I say it over and over again. I've been saying it for about 3 months now. But that is it, right? We want to, even if we're getting together for those small allowed gatherings, we want to keep distance. We want to wear a face covering. And we really want to consider our risk and the risk of the people coming together. Those vulnerable populations really need to think about whether or not it is appropriate for them, right? The risk is real, and the severity of the disease for those vulnerable populations is significant. And so we just want people to be responsible. Stay 6 feet away, wear a face covering, and if you're in a vulnerable population, try to consider that before you make any decisions.
Great, thank you, Frank. Rich, as promised, I have questions for you now. Rich, can you talk a little bit about how this all has impacted the work of the legislature and how you're interacting as a legislator at this time?
Sure. Well, just like everybody else, the legislature is in a sense a business, and we've tried to figure out how to make things work. Our clerks have done a great job. I commend them. They have kept the trains rolling. We've had our meetings, and we've been able to do the day-to-day business of passing resolutions and funding budget issues that you need to take care of. Where I think we've seen the greatest challenge is just not because you can't sit in the same room at the same time, making sure we're able to communicate. Certainly Zoom, and WebEx and all the other technology. I keep thinking if this pandemic had happened 5, 10 years ago, it would have been dramatically harder. That we have been able to operate, which is really good. Where I worry is at well, I guess I'd also say that I'll commend my colleagues for spending a tremendous amount of time trying to keep up with the constantly changing information flow and what the rules are and communicating that out to constituents. So being conduits for information, it's been really important. And I think I've seen an amazing amount of email from my colleagues on the legislature, and I'd say that's a good thing that they've been talking. But where I worry is that at the committee level, what's so important, I believe, is that it's transparent, that the public knows what we're doing, and making sure that the public is aware of information, of what's on the agendas, and if they're interested in it, they have an opportunity to comment. That's been a lot harder. And for example, we're in the middle of trying to figure out what to do about the census, that the census information has been delayed somewhat. We're also seeing low response in parts of the county, and trying to make sure that we're communicating that if you can respond, please get your census information in. It matters for all sorts of reasons, including proper districts, that each of the legislature members is representing about an even number of people. And we're going to have redistricting following the census. And we've been having a conversation, a very boring one to a lot of people, but it's really important, of how do we go about redistricting so that we don't leave the districts unbalanced for a long period of time. And the Government Operations Committee has been talking about that and really trying to reach out to the public to get input, saying, should we run the next time for a shorter term, which means an extra election in a couple of years or a year, but it means it could catch up with the information we get from the census. So we'd have better districts or more representative districts. At any rate, that kind of thing. I won't get into the weeds. I guess I'm already in the weeds, sorry. But trying to get answers, trying to make sure the public knows and that they can tell us what they think, good or bad. Yell at us if you think we're messing up, but yell at us, tell us. That's been a real challenge. And I hope we've got as many avenues open as possible.
Thank you,
I'll stop
Rich.
there.
All right, thank you. I I'm going to change the topic a little bit and dive into some testing questions. And I think it's going to put Frank on the hot seat for a while. So the rest of you want to relax. Oh, Jay instead? Okay. Yeah. So Frank, can you talk a little bit about the testing numbers recently? There has been some changes in the data and it was corrected and updated, and what caused that?
Sure. Yeah, we've got a lot of questions about that over the last week or so. And I want to start by saying that the numbers around cases, those recovered and those in the hospital, they have been consistent and are accurate and have always been accurate. And the reason for that is those are resulted tests, meaning we have the result, it's finite, we know it's there, and it's a countable number. The other numbers, the much larger one, the testing number, the total tests, the pending tests, that is a measure of something in process, right? So it's the collection of a sample. And again, have to give credit to Cayuga Health Systems for all of the work that they've done to make testing available and available in such large numbers. And so part of the challenge is when you collect a sample, it doesn't always end up in a result, right? Depending on a bunch of different steps along the way, including sample collection error, an individual that has an indeterminate result, or something happens at the laboratory where they're unable to get a result from that. So that is something that in its immediacy, when it's collected, turns into a sample collected. But by the time it gets all the way through the process, it doesn't result in a negative or a positive. So when you think about that, as we're reporting in real time the samples that are being collected, over the next few days as they evolve through the process, there's the potential that it might not turn into a result. And that is part of the challenge in reporting data. And I'll tell you, Cayuga Health Systems is not mandated to report those testing numbers to us. We're mandated to tell us the results, as is anyone that collects a sample, but they have been working with us from day one to give us access to this information that our community so wants. And so, quite frankly, it's a miracle that it's gone as well as it has with the significant growth in testing that's occurred. And to throw, even more of a wrench into the works with the addition of nursing homes and assisted living facilities, many of those facilities are collecting their own samples now and sending them to Cayuga Health Systems for testing. And last week, many of them were doing it for the first time. So you can imagine there was a learning curve on how to do that effectively and get good samples. So all of that plays a role in it. What I would assure the community is that, again, the total number of cases, those recovered, and hospitalizations are resulted information, and those have been correct throughout. The other number, we're giving what we know at the moment. At the end of the day, folks might recognize that we're posting those 7, 8 o'clock in the evening. And the reason for that is there are people working well and late into those hours to try to give the best numbers that we can at the end of the day. And there's going to be variability. And we just happened to see a more significant one last week because of all of those new variables that came into play.
Thanks, Frank. I'm still staying on the testing topic for a few more. As we talk about our testing methods, obviously they've changed some and they may change more in the future. Can you talk a little bit about those changes that we've seen and how they're happening in the future, if there are innovations coming, and how our reopening may be impacting our testing and those capabilities?
So there's a lot in there, Amy. I think a couple of things has happened. Our criteria expanded for who could get tested. It originally was just sick people and those that were close contacts, and those that the health department identified as potential exposures. It expanded to essential workers, then preoperatory, then nursing homes, assisted living facilities, then phase 1 workers. So it's continued to evolve with the people that we are sampling. As far as the testing capability, again, Cayuga Health System has done an amazing job of diversifying the ability and the type of testing that's available, so that way we have multiple avenues to get to results, which improves the timeliness of getting those results. The county is partnered and is purchasing a piece of equipment that will help increase that capacity as well for Cuyahoga Health Systems. So it continues to evolve, and Cuyahoga Health Systems is an amazing partner in trying to make as much sampling available as possible and as quickly getting to the results as possible.
Thank you, Frank. I'm going to shift a little bit to talk about recommendations. Do we recommend that if office workers can continue to work from home, that they should continue to do so, or should they be reopening the offices at this point? And we'll go with Frank. Do you have suggestions on that?
Sure. I think that's going to be up to the individual businesses and organizations to determine. I think for a lot of us, telework was something that was foreign and strange, and we weren't so comfortable dipping our toes into. But now that we've been forced to, I think it's a kind of opened our eyes a bit to the possibilities and how we might be able to work more effectively and efficiently, and allow people to, work from home, to create more time to be, with their families, to deal with daycare, those kind of issues. So I don't know that anyone needs to be in a rush to get back to the office. Certainly, we're still wanting to take a slow, methodical approach as we go through our reopening phases. And so any opportunity we have to limit potential exposures is a good opportunity. And I would encourage businesses and organizations to consider, do you need to bring people back into the office to do their work, or is this part of the new normal?
Thanks, Frank. Jason, in the community, there's been some talk about people from New York City and other areas are starting to come and vacation here. It's always a nice place to come in the summer months. If this aligns with our opening, how do we address this? How do we address people coming here from other places that may be hotspots?
I think we address it the same way we're addressing our current residents, and really we really don't take any different action. We don't take any special action. We educate visitors into our community about the actions we're taking, and we treat them no differently than anybody else that's in the community. The truth is how we prevent the disease here is the same way we prevent the disease in New York City or any other place in the state or in the country or on the planet for that matter. So, part of our local economy and culture is having visitors into our community. We welcome that. We welcome it, and we welcome the diverse folks from all over the globe to come into our community. We want to continue to encourage that. We just want to encourage it with safe conditions. We want people to be safe. We want people to wear masks. We want people to practice good hygiene. We want people to keep their distance. So I don't think it requires anything more other than to continue to educate the newcomers into the community that maybe aren't as fortunate as our current residents are to have the great public education piece that we've been able to put out and haven't been subject to it. We educate them, we welcome them, and we embrace them as they come into the community. And I think that fits with our culture here in Tompkins County.
Thanks, Jason. This is more on our operations about, we have a parent of a newly 16-year-old individual who is wondering when can they expect the DMV to open up?
Good question. We've had this quite a bit lately. The DMVs are most likely going to open in another week or so. That's the word that we've been receiving, probably another week, next week, if not next week, the week after. The question about road tests is one that we will have to get more specificity on. Obviously, there's the paper permit, and then there's the actual driver's test. I don't have any clear direction on that, other than I can probably say within the next 2 weeks, the DMVs will begin to be opening. And there will be more guidance on the specific services that the DMVs and the King County Clerk offices provide at that point in time. I would say, though, that the end is near, and soon they will be able to probably get their permit and begin to start driving, much to the parents' dismay.
Thanks, Jason. Frank, what are the plans and the capacity if we have someone that has COVID-19 and needs to be isolated from those people that they're living? How do they handle that? How do we handle?
Yeah, as part of the contact investigation, our nurses will talk that through with any COVID positive patient to find out what their living situation is and if they're comfortable and capable of isolating in their home. We try to work with them to find creative solutions to achieve that, because it's just easier to do it in a location that you're used to and you're comfortable in. If they're not able to and we need to find an alternative location, we have the ability and we have done that to provide them an alternative location to isolate while they're recovering.
All right, thank you. Another opening question for our town courts. Jason, when will our town courts be open?
So courts are under a different purview than necessarily municipalities. Courts have been partially open for processing through the Office of Court Administration. And as far as specifics as to when town courts will be open, we don't have the exact details on when they will start to see cases again. I do know that most courts are open for processing, and even our own county court is open for processing. But in terms of being able to get back into full court operations, that is yet to be seen. I suspect that when they do open, they'll probably incorporating much of the virtual platforms like this as much as possible. But courts right now are not fully open, and there is no foresight as to when that'll happen. Sometimes that courts work under a different operating oversight from the Office of Court Administration, and sometimes that guidance comes at different times without much forewarning, unfortunately.
Thanks, Jason. Jason, can you reshare the information you shared at the beginning about the phase 2 for those folks that just tuned into this and what we learned about an hour ago?
Yeah, about an hour ago. So before we came on the call tonight, we spoke with our governor's representation. Governor's rep advised us, and since we've been on this call, I've received some text messages from colleagues in other regions. They have received the same comments that phase 2 is not a go for tomorrow as of right now. There is no guidance on the industry specific guidelines for industries for phase 2, and right now we are not expected to open tomorrow. This is information we just received about an hour ago. We do have a control room meeting, regional meeting tonight at 7 or 7:30. If any new information comes from that, we will definitely push it out to our channels and to our media partners as well as our community partners. But right now, no opening for phase 2 as of now. However, advice is still for those pending industries that fall under that, which I believe is administrative services, professional services, also retail, real estate and rental and leasing. You can begin, I'm sure you already have, to continue to build on your reopening plans, following similar guidelines of other industries. They're very similar. And when we finally get that green light, you'll be ready to roll. But right now, there is no green light for phase 2 tomorrow. Again, if that changes tonight, we will definitely push it out and use all the channels we can to make sure everybody's educated.
Okay. This is my final question. It's always Frank's favorite, is the cheesy question at the end. So we'll start with you, Frank, on what ways are you finding to unwind during these times?
Yeah, well, this weekend was kind of the first opportunity in a long time to have a little bit of away time, and just being with family out, enjoying the weather, it was a big help. And I think just in general, acceptance of the things that you can't control, right? Obviously, right before this call, our whole plan got upended, and now we're going to have to rework that. And it's just part of the process. And I think that acceptance of it is going to change from hour to hour is part of, being able to navigate through the stress and high pressure of responding to this over a long period of time.
All right, Jay, how are you unwinding? We saw a little of this afternoon.
Well, in blue sky times, I do like to golf a lot. But nowadays, getting out of work here, I like to go home, hang out with my kids. My kids are 9 and 10 right now. They're a great age of just absolutely craziness. I'm either laughing with them and we're being silly and agitating my wife, or I'm yelling at them, because they're being silly, and then we're agitating my wife. So it's just a great time to hang out with them, and they're just a trip.
Great. Jason?
Unwinding, we have 4 children, 3 young ones at home, 5, 7, and 9. I can relate to Jay. They are a handful, and never a dull moment, put it that way. And the things that come out of their mouths, you can't imagine what they'll say or what's going through their mind. So we have a good time with them, trying to spend as much time with them as possible. Anybody that's been working through this realizes the stresses that come with it and the time constraints. So the time that we have is limited. Personally, I do a lot of gardening. So believe it or not, the past few weekends, I've found a few hours to get the gardens prepared and some vegetables in the garden in this odd spring of May. So those are just some things that we do in our house.
And following last week, Jay, I won't let you jump in. I will say that I also unwind getting outside. That's been huge lately. And fortunately, we've had some nice weekends where we can do that. And I have giant flower gardens that actually look like flower gardens this year. So that's been kind of nice to spend some time there. And Rich, I'll turn it to you to tell us how you unwind and go ahead and wrap us up.
Okay, well, thank you, everybody. Unwinding, I'm certainly not working as hard as all of you guys, but I'm doing some gardening, exercise. My big project is I decided I was going to make beer. And so I've been tending my, I wanted to make beer from whole grain, which is a new project. And I think it's going to be an epic failure, but it's been interesting along the way and I'm learning. Might turn out, we'll see. But
it looks like Jay is offering to taste test for you, Rich. So
peace. Yeah.
We would be happy to help to see if yes or not, Rich.
All right. Well, we'll see how that turns out along with everything else. So thank you to everybody who has tuned in. And obviously more information to come. Hopefully we'll have some very good news shortly on phase 2 that the state will get its guidance to us and we can proceed and keep moving forward. So
all
stay
right.
safe.
Thank you. Stay safe.
Thank you.
Good night, everyone.
Have a good night.